What is lipedema? Over 18 million women in the United States have lipedema, most of which has been misdiagnosed by doctors. Lipedema is a chronic medical condition characterized by a symmetric buildup of adipose tissue, fat, in the legs and arms. A common but under-recognized disorder, lipedema may cause pain, swelling, and easy bruising. It may be accompanied by an unusual texture within the fat that can feel like rice, peas, or walnuts beneath the surface of the skin. How does manual lymph drainage help with lipedema? Manual lymph drainage massages plays a significant role in helping individuals suffering with lipedema by aiding and managing their symptoms, by reducing swelling, improving lymphatic fluid drainage, and complementing other treatment strategies aimed at enhancing quality of life.
Hi, good morning. I'm Kathy Porter here at ABG Wellness, and I'm here with Kathleen Hammond.
Good morning.
And we are going to be listening to her journey with lipedema.
Hi, as Kathy said, I am Kathy Hammond. I'm almost 60 years old, so I have quite a history to tell you about my lipedema journey. I think a lot of you might relate to this, but I first noticed something different about myself when I was very young. It was probably kindergarten. This was in the late 60s, early 70s when go-go boots were in style. And all my girlfriends had go-go boots, and I would beg my mom to wear them, and none of them fit my legs, not a one. And my mom would always say, "Oh, you're just like your Busha," which is Polish grandmother. And I would look at pictures of her. She had passed before I was born, and I'd say, "That looks like my body." And she had just very solid trunk-like legs. And even in kindergarten, my legs were different than my friends. So fast forward a few years, I go through puberty. My body doesn't really change a whole lot except for I'd say very accelerated growth in my breast, which is not a typical lipedema symptom. Although we do know that lipedema is hormone driven. So, a lot of changes go on with those hormones. Fast forward, I have 3 pregnancies. My body doesn't really change except for continued breast growth. And now we're all the way up until, I'd say, 2008. And I decided to go in and have breast reduction surgery. After surgery, I felt great, and about a year later, I started going through a very high, stressful period in my life, and my arms began to grow. Now, if you know anything about lipedema, legs and arms are typical lipedema joint or typical areas that you will experience lipedema, that unusual fat growth. So, okay, let's watch my diet, let's do everything, continue working out, continue exercising. We fast forward a few more years, and I begin to have issues when I'm hiking. Difficult for me to keep up with my family when we hike. My legs just feel like concrete, and just more difficult for me to catch my breath. I'm tired all the time, which has been true my whole life. I've always slept more than anybody else in my family. I've slept more than my friends. I've needed naps all day long. I don't know if that has anything to do with lipedema, but I suspect it does, just simply because if your lymph fluid's not moving, you become sluggish. And that's what happens with your whole system. You're just slugging along. So in 2019, I was hiking and I injured my hip and went through a ton of different therapies, and we finally determined I needed a hip replacement. So I had a hip replacement done, and when I went for my follow-up, my doctor said, "Kathy, I just want to tell you that when I did your hip replacement, I noticed some very unusual fat in your hip." And I said, "Well, what does that mean?" And he said, "I have no idea. I've only seen it in some of my women patients, and I don't know what it means." Now, this is somebody in our medical profession, and they had no idea what lipedema is. So that planted a seed in my head, and I mentioned it to doctors, and they're like, "We don't know what that means. We have no idea what unusual fat is." Okay, So I'd say it was probably 2, maybe 3 more years I was on Facebook. And social media does have its benefits, because somebody had said, my legs are so heavy, I'd like to have some kind of plastic surgery. Does anybody have any advice? And one of the people on this Facebook group said, have you looked into the fact that you might have lipedema? And she posted a link to the medical symptoms of lipedema. And I thought, So I went and I looked, and sure enough, I had every one of those things that were listed, and my legs looked exactly like the images that they were showing on this information page. So then I started joining other Facebook groups, and that's when a couple of doctors started showing up. And at that time, there weren't a lot of surgeons out there that we were aware of that would deal with lipedema. So I found a doctor that was in Kentucky, and at that time they did virtual appointments. So I sent complete pictures of my body to them, and they confirmed that I had stage 3, possibly stage 4 lipedema in my legs, and stage 2, stage 3 in my arms. And they recommended a series of surgeries to deal with that lipedema. Now I'm going to backtrack just a little bit here and go back to talking about the medical profession. When I was 21 and began going every year for a physical, my doctors always mentioned how heavy my ankles were and that I was retaining fluid. And from the time I was 21 until today, I've been on a water pill for those heavy ankles. Now we know that's not water in those ankles, that is lipedema, and it's a typical symptom, those heavy cankles you might call it. But doctors had no idea, and even today, if I go to a doctor that is not familiar with lipedema, it's one of the first things that they'll say is, do you hold water in your ankles? Well, now that I've had surgery, it's not that big of an issue, but up until my surgeries, that's what they would always ask, and it was a big concern for them. So it might not be water weight that you're holding, it could just be lipedema or unusual fat. So I had my first surgery in March of 2023, and 5 liters of unusual fat was removed from just the fronts of my legs. Now, when you think of 5 liters, it's really hard to think, how much is 5 liters? Well, if you look at a 2-liter bottle of soda and take 2.5 of those, that's 5 liters of unusual fat that has been removed from my legs, the fronts of my legs. Since then, I've had 2 more surgeries, and over 10 liters have been removed from my legs of unusual fat. I noticed improvement almost immediately when I had that first surgery. The heaviness was gone. So while I didn't have a lot of pain in my extremities, I did have that heaviness, and it was just like you're lugging concrete along all day. And I remember after my recovery going up the stairs, and I could run up the stairs. My legs were functioning again. I had so much more energy. I wasn't requiring as much sleep as I needed before. And once I had gone through all my MLD following that surgery, I began doing MLD on myself, or my husband, he had watched how MLD was done, and he began doing it on me. So all these things kind of made sense after a while, why I felt the way I did, why I looked the way I did. And it was all just this disease that's so underdiagnosed in women, and that's lipedema. So I want to talk a little bit about the 5 surgeries that I had. So like I said, I had 5 surgeries. I had my fronts of my legs done, and then I needed to find a new doctor for numerous reasons. And I found one in Washington, the state of Washington, and he dealt with the backs of my legs, and he felt that when you have one surgery done on an extremity and you require more, it's very important to have that done within 5 or 6 months simply because of the regrowth factor. So until you deal with that entire disease in that extremity, if you don't get it all, it's going to continue to grow. So it's very important to be proactive and deal with the lipedema in whatever extremity you're dealing with. So in my case, I had the backs of my legs done then in the fall of 2023. 6 weeks later, I had my arms done, and 6 weeks after that, I had my trunk done. Everything was doing well, except for my legs. I wasn't pleased with how my ankles looked. And if you think about unusual fat and that it's been there since I knew I was 5 years old, so it's been on me for 45 or 50 years, it's going to be very tough. It's hard, it's concrete, it's fibrous, it has worked itself into your system. It takes a lot to get that out. And so we had to go back in and have another surgery to try to break up that in the ankles. Am I pleased with how my ankles look now? I'd say 75%. They're never going to be perfect how they look, but they feel great. I now have mobility back in my ankles that I didn't realize I was missing. My legs feel great. I'd say overall, I'm 100% better than I used to be. I have so much more energy. I just feel good. And until you've realized how poorly you felt and then suddenly you feel good, you don't realize how bad it had gotten. Next, I want to talk a little bit about the things I did before I even knew I had lipedema to try to make myself feel better. And one of those things was in 2009, I bought a whole body vibration machine, and I would use that for 10 to 20 minutes a day. And I had no idea what lymphatic fluid was, but unknowingly, I was working to get that lymphatic fluid moving throughout my body. I think that probably helped with the progression of my disease. It might have slowed it down a little bit before I needed those surgeries. I'm not really sure, to be honest. I do know, looking back, I wish I had known I had lipedema when I was a stage 1 or a stage 2. The recovery, the surgeries required are so much less if you can deal with the fat before it takes over your body. Other things that I have just done unknowingly throughout my entire journey is I've always been low carb, or for the most part, I've tried to be low carb. Lipedema fat, it builds off of not only hormone fluctuations, but carbs, especially refined sugars. So unknowingly, I just always ate more of a high protein diet, tried to limit my refined sugars. It's those times in my life when stress might have been high and I might have turned to sugar more that I did notice that I had a little bit more growth in, like my saddlebag area, or my butt shelf is what they call that area above your rear end, that some lipedema patients get it, where it's just, you can just tell it's not your typical rear end. And especially my arms. After my breast surgery, when I went through a lot of stress, my arms did really grow. So going back to some other things that I do to manage lipedema, and even though it's taken out of my system, my doctor feels that I won't have any more issues in the future as long as I watch my diet and continue to exercise. These are other things I incorporate daily or weekly into my routine. I do an infrared sauna. I work out every single day, so resistance training and cardio, all those things help move that lymphatic fluid throughout your body. One thing that's not often mentioned in almost 99% of cases of women with lipedema is there's an underlying connective tissue disease. So it's very important to keep your muscles strong to help counteract that tissue issue. I think that's probably why I had an injury when I was hiking that led to the hip replacement. It makes sense when I look back at my life, all the injuries I had. It was nothing for me to sprain ankles all the time or twist my knee or whatever the case might be. I had a lot of issues, and it makes sense now knowing I have an underlying connective tissue disorder. And as a woman with this disorder, I have to be very cognizant of that. When I now meet with doctors, even my dentist, I have to explain that I do have a connective tissue disorder. One of the things that we found with the dentist is, especially since I hit menopause, it's very easy to have receding gums or be prone to gum disease as a result of connective tissue. So you really need to be aware of that. Make sure your dentist knows, and make sure the people that you see, if it's a chiropractor, if it's any kind of health professional, a physical therapist, etc., they need to be aware of your condition. Other things that I do to help treat my disease today is I dry brush. I continue to use the vibration machine every day. I have leg pumps that I use on my legs, probably not as much now that I've had my surgery, but if I've exercised extra hard or done a long hike, I'll put those pumps on and they really help. I continue to do MLD on myself, or my husband will do it on me. I do massage. One thing that I just learned recently, especially if I've been on my feet a lot all day and I'll notice that my ankles have started to swell, I've begun to use castor oil packs. One of my doctors had recommended that, and that's where you take organic castor oil, put it on the affected joint, and wrap it in 100% cotton. So I have 100% cotton socks, and I'll put castor oil on before I go to bed, put those socks on, and in the morning when I wake up, my legs are so much better. The swelling is gone. And you'll notice that you'll have to go to the bathroom a lot more during the night because that lymphatic fluid is coming out and your kidneys are processing it. So just be aware of that you're probably not going to get that great of a sleep that night just because you're up all night peeing. I do want to emphasize again how important exercise and diet is. That's what's going to control this disease. Watch your hormones. One final thing is, because we know this is a hormone-driven disease, but there's not a lot of studies done on postmenopausal women with hormones. I have begun a bioidentical hormone replacement therapy system, and it has made me feel fantastic. It's replaced those hormones that through menopause you lose. But there's not studies done on what that means for a lipedema patient. So it's just something I'm monitoring. My doctor assures me that my lipedema is gone, it's been treated, but we don't know what that hormone will do, those hormones that I'm now taking. Again, I go back to those Facebook groups that I'm in, and I've talked to other women that are going through the same thing that are on HRT. They have not noticed any growth, and some of them have been on therapy for 3 or 4 years, some even longer, and they have not noticed that growth. Again, they're very cautious about their diet. They continue to exercise. So I think it's just a whole health approach, and as a woman with lipedema, it's a lot bigger responsibility of taking care of yourself than a typical woman. And it's easy to fall into the mental thing of, why me? Why do I have to go through this? Why can't I be like everybody else? But you have to take responsibility for it and do the things you need to. If you've gotten stagnant and if you're not moving, get up and walk a little bit more every day. Move that lymphatic fluid, get it going through your body. Strengthen your muscles as much as you can to support your body. And seek medical advice. It's hard. I know there's not many physicians out there that know what lipedema is, but find some of those groups on Facebook and look for doctors in your area. Go to them. Get a proper diagnosis if you even suspect you have it. It's better to treat lipedema when it's in its early stages. You don't have as many surgeries, and you're going to feel so much better. And then my final advice is, we know there's a genetic component to lipedema. Look at your daughters, look at your granddaughters, talk to them about the disease. Give them advice if you see any symptoms of lipedema in them so that they can be proactive in treating the disease. And that's it for today.
for coming in and giving us your story. We very much appreciate it so much, and we're so happy to see that you are doing very well on your journey. Thank you.
Thank you.
Thank you for visiting us. In order to become more aware of the issues associated with the symptoms and treatment of lipedema, please email me at kathy@abgwellness.com. Or call our office at 480-322-4981 or text/call my cell at 808-282-3355.